My name is Pat Hibberd. I'm an infectious disease physician at Massachusetts General Hospital, and I'm also a professor of pediatrics at Harvard Medical School.
Future directions for research on probiotics.
The number of bugs that we have in the gastrointestinal tract make the gastrointestinal tract a very active area for research in probiotics. And I think that will continue. There is certainly way too many diseases of the gastrointestinal tract, and I think research will definitely continue in that area. But the areas that I see as potentially new and different are thinking about how the probiotics interact with our own immune system and what could we do to exploit the properties of probiotics to get better immune responses. And my real passion is improving the immune responses to prevent infections in people who are at the greatest risk. So who would they be? They are the little babies, people at the extremes of life because the immune system is not working that well when babies are born, and also the elderly, in whom the immune system is no longer working as well. But there's also another group of people. These are people who are immunocompromised as a result of other diseases that they may have throughout their life. And I'd love to see what we can do with probiotics to safely improve their immune capabilities such that they are not so much at risk of infectious diseases. One particular area that I have a lot of interest in is trying to improve the immune response to certain vaccines, particularly vaccines that are delivered not as shots, but to what we call the mucosal surfaces. Because if people are taking probiotics, particularly by mouth, those probiotics are landing on the same mucosal surfaces as those vaccines. What vaccines are these? These include vaccines like flu mist to prevent influenza, and also the rotavirus vaccine to prevent diarrhea in little kids. That may not be needed so much in the United States because the rotavirus vaccine works terrifically well here. But it doesn't work as well in other countries, and it's possible that things could be done with probiotics to improve the immune response to the rotavirus vaccine. So those are two potential areas that I think are quite believable for future directions for research. There are many, many areas that are being investigated for novel approaches for probiotics. I think many of them are a little further away as being ready for studies, but I really think in a couple of years we'll have some basic information to guide some really novel areas of research outside infectious diseases, and we'll be hearing a lot more about those in 2 to 3 years, I think.